Imagine it's 1943, and you're one of 241 prisoners at Terre Haute in Indiana, participating in a gonorrhea prevention study. Soldiers are returning from war with sexually transmitted diseases. The military is desperate to find a solution. They offer prisoners $100, a certificate of merit, and a letter of commendation to the parole board.
So you're telling me the prisoners agreed to be infected with the disease for $100, a certificate of merit, and a letter of commendation to the parole board? That's kind of alarming. I mean, sure, they needed to find a preventive treatment, but would anyone willingly agree to be studied this way?
The experiment didn't work, so the U.S. looked to Guatemala, where they had some government support. From 1946 to 1948, over 1,300 people, including commercial sex workers, soldiers, prisoners, and psychiatric patients, were infected with syphilis, gonorrhea, and other STDs, without consent. This was all while they were believing they were receiving free healthcare, and hundreds of people went untreated.
In a way, that's similar to the Tuskegee Syphilis study, which lasted from 1932 to 1972. In the Tuskegee experiment, 400 Black men consented to the study of syphilis when no treatment was available, but then the 400 were denied treatment with penicillin between 1943 to 1972, when penicillin became a known treatment for syphilis.
The goal was to observe syphilis's effects, even leading to death. Local doctors were instructed not to treat the men with penicillin, despite it becoming available in 1943.
This study would have lasted longer if not for Peter Buxton, a public health service researcher. He filed an official protest in 1966 after first finding out about it, and again in 1968, but both were rejected. So undeterred for 6 years, he leaked the story to the press in 1972, leading to the study's termination. This sparked stricter laws like the National Research Act of 1974, which required informed consent and created review boards to protect human subjects.
And the Belmont Report in 1979, which established ethical principles that guide human subjects that are researched today. Our unfortunate scientific and medical research history should remind every researcher, every healthcare provider, and policymakers it is vital we all make an ongoing commitment to exercise empathy, transparency, integrity, and courage as we seek to rebuild trust and positively impact our diverse communities and the whole world.